My name is Donna Zollman. I'm a physician investigator at the Center for Innovation to Implementation at VA Palo Alto, and I'm also an assistant professor at Stanford University. When I was doing my residency in internal medicine at Michigan, I had an opportunity to work with the VA investigators at the Ann Arbor VA and do a research project with them. And I was also doing a clinic at the VA. And so I had an opportunity to see how my clinical work could create research questions that I could then pursue and potentially help develop programs or have a policy impact that could have an influence on veterans nationwide. And I really was excited by that and ended up pursuing advanced fellowship in that area. So my research focuses on veterans who have complex medical profiles and often have social behavioral challenges that they're facing that create additional issues for them in managing their health and health care. And for several years now, I've been studying the kinds of patterns of care that those veterans have and their needs. And we had opportunities to test some programs for them. And recently, I've had an opportunity to start working with VA's Offices of Rural Health and Connected Care to learn more about how we can help those veterans by giving them access to care virtually. So particularly for veterans who have complex medical issues, but they can't easily get into a VA facility. Either they have a health issue that makes them homebound, or maybe they have commitments as a caregiver or because of work or school, or they live in a location where it's difficult for them to get to a VA facility. For those veterans, we can now offer them virtual care through VA Video Connect. For veterans who don't have their own device that they can use to connect, the VA has tablets that we can send to those veterans. And so we're starting to look at who's getting those tablets and how they're using them. I think what the video telehealth program is specifically aimed to do is to give veterans access to VA services that they might not be able to easily get otherwise because they live at a distance, but that they need because of their unique medical issues. So, for example, veterans who have PTSD or military sexual trauma, who have issues that the VA is especially well positioned to handle and help them with, will be able to get care for those issues from afar with video telehealth. So I deeply value these relationships that we have with our operations partners. I work closely with the Offices of Primary Care, Rural Health, and Connected Care to see if we can provide better services for high-need veterans. For example, the Office of Rural Health was interested in expanding access to care for rural veterans, and they provided the support for these 5,000 video-enabled tablets to send to veterans with access barriers. They were interested in an evaluation of those tablets to see how those tablets were being used and whether they benefiting the patients. So we had an opportunity to work closely with them and Office of Connected Care to explore the veterans who were getting the tablets, whether they liked them, whether they felt that they helped meet their needs, how they were using them, and for what types of clinical care. And I think the information we provided was very useful to the Office of Rural Health in deciding whether to expand that program in the future. In fact, we recently learned that Office of Connected Care is going to be rapidly expanding the use of these VA video tablets, and hopefully we'll be sending them to, we'll have 75,000 tablets in the future. I think it's that opportunity to see patients in clinic, patients who often have complex medical, social, behavioral needs, which is the patient population I'm interested in from a research perspective too, to get to know them as individuals, to see opportunities where there might be ways we can improve their care, and then to test programs, evaluate them, and have the opportunity to potentially scale those up nationally. I think that's one of the really exciting things about working in the VA. I would say that working with veterans has really deepened my sense of mission in what I'm doing. I have a feeling every day that the work that I do has meaning and can change the lives and health trajectories of a lot of people who have given a lot to our country. So I feel incredibly lucky to be doing this work.